and Dr. Karen Appel, Board of Directors of the Manitoba College of Family Physicians. And today, to begin our announcement, I'd like to call on Premier Goertzen.
Thanks so much, Mike, and thank you for welcoming us here at Nine Circles. We appreciate it. I want to thank all of our medical personnel who are here this morning, and of course joining us virtually across the province, doctors and pharmacists represented today by Pharmacists Manitoba, Manitoba College of Family Physicians and Doctors Manitoba. All of our medical professionals in Manitoba and across Canada have been under a lot of pressure in the last 18 months. It has been a very, very difficult time, and we want to thank them for what they've done and for what they are continuing to do and what they are committed to continue to do. We know that the COVID-19 vaccinations and the vaccines are our best way through this pandemic. It is our best tool to keep our businesses open. It's our best tool to keep our schools open, best tool to keep our houses of worship open, and our best tool to keep our medical facilities and our hospitals from being overwhelmed. And the response to the vaccine effort so far to date has been remarkable. But there is a way to go yet to ensure that we blunt the fourth wave and that we continue to get through this pandemic. We have seen the impact of the fourth wave in other provinces, and we know that there continues to be lots to do when it comes to vaccination because it is incredibly difficult in terms of what's being experienced in other places, and we do not want to be there again. The vaccination effort and the uptake by Manitobans has been significant. It has been heroic, and it has been one of the great successes that we have seen through this pandemic. But every vaccination matters, everyone is important, and there are many more that have to be done. Today's announcement is recognizing that we are now in a different stage of the vaccination campaign. As a political leader, I've been open about being vaccinated, as is my family, my son and my wife, and we have encouraged others in Manitoba and in our community to be vaccinated, and we will continue to do that. But I also recognize that at this point, many months in, those who remain vaccinated, at least some of them, are not interested anymore in hearing from politicians. And they are not necessarily listening to us as political leaders. They are not getting vaccinated for other reasons, perhaps. And that brings us here today. Doctors, physicians, pharmacists, these are the people that have earned the trust of Manitobans in many different ways and for many different reasons. Manitobans have trusted them to deliver their babies. They have trusted them when they have gone through a difficult diagnosis like cancer. They have trusted them with their loved ones. They've helped them on their prescriptions in many, many different ways. They've taken their advice. They've built a relationship of trust over the years, and now we are asking Manitobans to trust them again. Today we will focus more on a direct relationship between pharmacists and physicians and Manitobans to build upon those years of trust. We are grateful as a government that our medical professionals are stepping up again, willing to do more, willing to continue on in this difficult time. We thank them for all of their efforts. They are doing what Manitobans are famous for, and they're helping us get through these difficult days. Thank you very much.
Thank you, Premier. I'd now like to call on Minister Gordon.
Thank you, Premier Goertzen. I'm Audrey Gordon, the Minister of Health and Seniors Care. I'd like to start by thanking Mike Payne and his team here at Nine Circles Community Health Centre for welcoming us today for this announcement. I know you've been recognized already, but I'd like to recognize you again. Thank you to our honored guests today, Ashley Hart, who is the President of Pharmacists Manitoba, Karen Apple, Board Director at Manitoba College of Family Physicians, and Dr. Christian Thompson. He's the president of Doctors Manitoba, and I had the pleasure of meeting with him last week. We had a very good discussion. Thank you all for joining us for this announcement. As the Premier mentioned, today's announcement builds on our successes and ushers in the next phase of our fight against COVID-19. Today, I'm here to announce an exciting partnership with Doctors Manitoba and Pharmacists Manitoba to support health professionals working in this province. Our government is investing nearly $14 million to boost the number of first and second doses in our province and help healthcare workers across Manitoba engage in more targeted local outreach. Physicians and pharmacists will be able to develop their own strategies to connect with patients in their homes and communities, building on their local knowledge. Training will be developed by Doctors Manitoba, the Manitoba College of Family Physicians, and the University of Manitoba. And this will be based on an approach piloted in British Columbia and has been supported by the Public Health Agency of Canada. This will give professionals the tools to respond to questions or concerns from their vaccine-hesitant individuals with the goal of eliminating misinformation about the immunization. Funding will also support our community immunization clinics, where vaccine uptake is lower currently than 75%. Our goal is to vaccinate as many Manitobans as we can. We're excited to bring the focus back to our communities and neighborhoods, as these partnerships really do support a regionalized approach to immunization in Manitoba. Thank you so very much.
Thank you, Minister Gordon. And now I'll introduce Dr. Christian Thompson, the President of Doctors Manitoba.
Thanks so much. Thanks to Night Circles for having us here. So good morning. My name is Dr. Christian Thompson, and I'm President of Doctors Manitoba. I just want to start off today by thanking Premier Goertzen and Minister Gordon for reaching out to Doctors Manitoba and listening to the concerns of physicians and listening to our advice. As an emergency medicine physician working at St. Boniface, I unfortunately have seen the sickest of the sick patients suffering from COVID-19. And as the third wave started to settle, we started seeing fewer and fewer patients. I actually went several weeks without seeing a single COVID patient. And why was that? It's because Manitobans rolled up their sleeves and got the shot. Vaccination has completely changed the game. And we finally found a way to win, to beat the virus. Unfortunately, however, over the last 2 weeks, I've started seeing COVID patients in my ER. And every single COVID patient I've seen has been unvaccinated. Over the pandemic, thousands have needed hospital care, and over 1,200 Manitobans have died from this disease. And these aren't just numbers. These are our neighbors, our family, our friends, and our loved ones. And we know this disease is very serious, but severe illness and death is largely preventable thanks to the vaccine. We know that the COVID vaccines work. Doctors trust the safety and the effectiveness of the COVID-19 vaccines. And that's why over 99% of physicians are vaccinated, and why every single physician that I know is recommending vaccinations to all of their patients. We know that there's a lot of information circulating out there, and some Manitobans have questions, or perhaps they're uncertain about the COVID vaccines. Today's announcement will help doctors spend more time with their patients who have held off getting vaccinated. Doctors are here to discuss these concerns and share the latest facts and answer questions that they might have about the vaccine. As physicians, we take the concept of informed consent very seriously. And every medical intervention that we do requires a patient's consent, and that includes the vaccine. We're here to help each and every Manitoban make an informed decision, and we ask the opportunity to discuss your concerns before you make a final decision. To every Manitoban that's been vaccinated, thank you. In '97, when the floodwaters came, we went outside. We rolled up our sleeves for a different reason, to work and help our neighbors pile up sandbags. We are friendly Manitoba, and we live this motto by supporting each other, respecting one another, and taking care of each other. And getting vaccinated is how so many Manitobans have shown us what friendly Manitoba really means. To every Manitoban who has not been vaccinated yet, I have a simple message for you. Doctors are here to help. Talk to your doctor. Or find a physician at manitobavaccine.ca. This website has answers from physicians and specialists and will help answer some of the most common questions about COVID vaccines. And there's many more resources and to help you get the answers that you need to make an informed decision. We will get through this pandemic together. Thank you.
Thank you, Dr. Thompson. Now I'll call on Dr. Karen Appel from the Manitoba College of Family Physicians.
On behalf of the Manitoba College of Family Physicians, I want to thank the Government of Manitoba for providing additional resources in order to further our efforts in combating the COVID-19 pandemic. As the professional home of Manitoba Family Physicians, we are eager to support our members in addressing the needs of some of our most vulnerable Manitobans. These efforts will ultimately help protect our healthcare system and communities as a whole. As the foundation of our community's medical neighborhoods, our membership has the capacity, context, and relationships to lead team-based approaches addressing vaccine hesitancy. As an organization, we look forward to supporting partnerships in furthering our COVID-19 vaccination efforts.
Thank you, Dr. Appel. And finally, I'll call on Ashley Hart to bring remarks on behalf of Pharmacists Manitoba.
Thank you. Thank you, everyone, and good morning. My name is Ashley Hart, and I am president of Pharmacists Manitoba. Thank you for having me here today. On behalf of Pharmacists Manitoba, I would like to say that we are pleased to collaborate on this initiative to increase vaccine uptake in Manitoba by bringing vaccinations directly to the community. Throughout the pandemic, pharmacists have worked tirelessly to provide their patients with accessible and reliable care and information, and they have continued to foster trusted and lasting relationships with their patients. Community pharmacists are uniquely positioned as the most accessible healthcare providers and are often a sounding board for concerns and questions from those they serve. This allows them valuable insight into their patient base, into the community. Pharmacists are an integral part of community-based collaborative health strategy, and we look forward to being involved in efforts to reduce barriers and save lives through this grassroots initiative to increase vaccination uptake. Thank you to the Manitoba government for involving us in this initiative and engaging with us. When healthcare providers like pharmacists and physicians come together with a collaborative approach with community leaders, we are better able to serve our communities. We are excited to participate in innovative ways to promote a more healthy Manitoba. Thank you.
Have to boot you out. Thank you, Ashley, and thanks everybody for being here today. This is a really important investment that I'm confident will help improve vaccine access for many, many people. Just before we close, I would be remiss, since you're in the community, to not encourage folks to check out www.ninecircles.ca. Learn a bit more about Nine Circles and our Red Ribbon Walk and Run, which is happening this week. Another great way to support the community. And with that, this is the end of the formal announcement, and now there'll be time for the media to ask questions directly of our speakers, and thank you very much for being here today.
We'll start with questions on announcements specific, and then if there's other topics, we can do this after, okay?
Dr. Thompson, I know,
Okay.
I know doctors, physicians, and all those in the medical community have been available for consultations to talk with patients. How does this change things? How does this announcement, this $14 million, change what you do, how you approach patients or those with questions about vaccines?
Right. I think what this does is it allows, physicians to reach out individually to their patients. As Premier Goertzen said, physicians are, the trusted health professionals for their patients. We help them, through birth, through death, from illness, cancer. And so we are a trusted profession with information that will help alleviate concerns, address factual inaccuracies. I think there's a lot of misinformation out there, and I think really that one-on-one individual connection that a patient has with their trusted physician is the best way to make sure that the right information is given and that patients can make the informed decision for themselves. But I think having all the facts and having that trusted relationship with their physician is really the way to go.
Was that not happening much before? Patients coming to the doctor with information on the vaccine?
So it was, absolutely. Physicians, were absolutely part of the effort in getting almost 80% of this province double vaccinated. Now there are a lot of Manitobans, for one reason or another, who have held off getting vaccinated, and there's lots of reasons for that. And I think having that individual approach and that one-on-one connection will really help make that a reality and really get those numbers up higher. What this funding does allow for is for physicians really to spend that quality time with their patients to help them make an informed decision.
The training that's being offered, what is the intent at the end of the day? What skills or needs are going to be addressed that physicians and pharmacists don't already have?
Right. I mean, I don't think that there's going to augment the skills that we already have. I mean, I think we're well versed and well knowledgeable to counsel our patients. I think really it's more the time that it'll allow healthcare professionals to interact and spend time with their patients. And certainly administrative resources in terms of having time and resources to reach out and actually call the patients. That is a huge administrative burden for clinics. And so having that resource available to actually reach out and connect with the patients, I think, is the big part of it.
And this might be a question for the minister, but I was wondering why physicians and pharmacists haven't already been given that client list to begin that outreach to surrounding vaccinated.
Well, I think that's a good question, but I want to clarify that they have been. So initially, the focus was on getting as many Manitobans as possible vaccinated, and individuals rolled up their sleeves. As the doctor said, over 80% of Manitobans have done that. But now we have a pocket of, or a grouping of individuals that are vaccine hesitant. So now we have to take a targeted approach to addressing that issue and going to the local, community, and regional levels to do that. So they have been very much involved, but now we're going to be taking a more targeted approach to the vaccine hesitant individuals.
Do you have an idea of how many physicians and pharmacists will be participating in this outreach initiative?
Well, I could look to the college, but I think they all will be. Yes? Yeah. Okay. I'll let you.
A good portion of this initiative is developing team-based care and developing the medical neighborhood model, because different individuals respond to messaging in different ways. And so as a result, by working together, by bringing teams together, we have a higher chance of actually being able to convey the messaging that we want to the individuals who have thus far been somewhat hesitant about getting the vaccine. And as a result, we are hoping to improve on our successes and actually allow our patients and community members to be comfortable in actually receiving the vaccine. And that's how we're aiming to target specific individuals, by working together, bringing the medical community together, and approaching the situation to help bring individuals what they need, as opposed to just offering what we offer.
Minister, the funding says that there could be up to 100 smaller clinics a week. What are these clinics going to be like? Are these clinics similar to some of the community clinics that have been run by different organizations? Is expansion on that, or is this mostly going to be through different physicians' offices or doctors' offices, or pharmacies?
So a combination of all the things that you have mentioned, but in addition to that, we want to make clinics more flexible. So what does a clinic mean? It could be a mobile clinic, it could be through a van, it could be a pop-up clinic, it could be a clinic in a community center. So we want to expand the definition of clinic, and we want that definition expanded to meet the needs of the individuals in local communities.
Is this kind of a shift from taking, moving from the focused immunization teams that the vaccine the task force had established, and putting more emphasis on physicians and pharmacists in providing immunizations at this point? Like, are we seeing a shift in where the resources are coming from to deliver vaccines? Is that what's happening?
So we're going to continue the efforts on all fronts. So you may have heard that we had reduced some of our focus on the super sites, and we're moving more to a local model. So this is doing more of what we need to do at the community level to address the vaccine hesitant population. So the focus is definitely on a local level.
Do you expect these to be focused in the south, where there is quite a bit of vaccine hesitancy, or are we going to see them quite a bit in Winnipeg, or where should we be looking for these clinics?
So all the regional health authorities have identified their top 5 priorities in terms of the work that we want to do around this funding. So it will be all the regional health authorities. Winnipeg has their issues, the North, Southern Health, Prairie Mountain. So they've identified their top priorities and how they plan to design local solutions. So it's not one regional health authority focus, it's all 5.
Are you starting to see the vaccine hesitancy lift through all these campaigns, or are you just seeing more people get more and more dug in? Are you actually starting to see some headway being made?
So there is some movement, but we want that to occur faster, because as you know, we are headed towards a 4th wave. I don't think anyone is denying that, and so what we want to do is increase the numbers of vaccinations as quickly as possible.
On the 4th wave, and I asked Dr. Jazz about this a few weeks ago and kind of gave a non-answer. Is the government planning on making any other changes to its response to the 4th wave, as opposed to just hoping people get vaccinated? Or are there going to be changes to the way that the health system actually responds to avoid the ICU crisis that we had in the 3rd wave?
Well, I will share with you that we talk about this every day. At the end of every day, we are in discussions as a team talking about what is happening in the system. What do we see across the country in terms of changes? When might we peak in terms of the 4th wave? And what changes need to be made in our health system at the acute level as well as at the community level? So we look to public health to guide us in making those decisions, and we will be making them as we go along.
Do you expect to release that plan before the 4th Or is it just going to be when we get that extreme point with the ICUs that we'll have a better idea of how the health system's going to respond?
Well, I think public health has been very open and transparent in terms of sharing information on a regular, consistent, ongoing basis. We're doing that through our press conferences. We have one this afternoon as well. So we're keeping the public and healthcare professionals very much involved in what is happening. We've shared our modeling. So we're going to continue to operate in a very transparent manner. Sure. Okay.
I wanted to get your thoughts on the gains that People's Party of Canada made in the 40 case last night coming in.
Yeah, I mean, obviously, this election was, framed in a lot of different ways, and in different parts of the country, there were issues that resonated more strongly. Clearly, in some parts of Canada, there were, parties who were concerned about some of the pandemic response, and they framed their campaigns around that response. My belief is that, ultimately, Canadians overall took a look at how the different parties were presenting themselves, and overwhelmingly said that we need to continue to work together to get through this pandemic, whether that was the response from the Liberals or the Conservatives or the NDP. They broadly saw the need to continue to work together to try to move through the pandemic in a way that is working together with public health officials across Canada. Those other parties who had different views, I mean, it's a democratic system, so they expressed it, and those who decided to support them did so in that democratic system.
Were you surprised at all by the number of votes that the party was able to capture in Southern Manitoba?
No, I mean, obviously, these are divided times, and I think that's one of the things that is most unfortunate that we've seen over the last 18 months is how divided society is. There's a lot of different reasons that people vote for different parties. My hope, of course, is that the division, it's always going to be a good reason for people to have a democratic debate about a lot of different issues, to do it respectfully. I do believe that division will dissipate as we move through the pandemic, and then hopefully by the time we get to the next federal election, the debate points would be quite different than the ones that were this election.
Coming out of this federal election, the seats in the House are basically the same. Do you expect any change in Ottawa's approach to working with provinces on things like healthcare funding and the health transfer agreement? Did you see any headway there, or did you get any other kind of feelings about the approach to healthcare from the Liberals through their campaign?
Well, I mean, there's no question that healthcare was a big focus of every party during the campaign, partly because of the pandemic, not specifically to the Canada healthcare transfers, but all parties talked about the need to provide investment for healthcare. So we will, as premiers, be meeting together virtually in the next few days to speak about both the federal election, the results, and then our plans going forward. And I'm sure that we will continue to be unified as we have been before about the need for greater support from the federal government on Canada healthcare transfers. As you know, because we've debated it for a long time, there are some provinces, including Manitoba, where the support for healthcare has dropped significantly below 50-50 to the point where in some cases it's below 20% from the federal government. That's not sustainable. That's been highlighted, I think, during the pandemic, but it was there before as well. So premiers remain united on the need for a better deal for all Canadians when it comes to health care. We'll engage with the federal Liberal government now, as we did before. I know that Prime Minister Trudeau, when he first got elected, made a commitment to meet with the premiers specifically about that in a dedicated Prime Minister meeting. Hopefully that fulfillment of that province, while a few years late and a few terms after, still happens. And I think he probably recognizes, as much as any Canadian does, the importance of a better healthcare deal for all Canadians.
How do you feel about another term of Justin Trudeau? Have you reached out to him to congratulate him or anything like that?
Well, I didn't reach out to him last night. I think he probably had other things going on. I have put out messages of congratulations to the federal Liberal government and to all those who ran, everybody who puts their name on a ballot. betters the democratic system. I think it's good that people participate in elections, even if I don't agree with everybody's positions. It's good to have that democratic discussion. So, you know, I think that our relationship with the federal government will continue to be collaborative. I know the ministers are always meeting with the various ministers in their respective departments. When I was health minister, I had a good relationship with then Jane Philpott and Minister Pettipaw-Taylor. I think those relationships are often, you know, quite strong at the minister-to-minister level. They'll continue to be. And I'm happy in my time to work with Prime Minister Trudeau and others who I might be working with in the future. I think it's good that we have those discussions. We won't always agree, but it's good that they're done respectfully at a national, provincial level. And I believe that they should be done respectfully, collaboratively, and always working towards the betterment of all Canadians.
One or two longer folks. Yeah, I have one more question on the subject of public health and vaccines. So we've heard from the police chief in Winkler, physicians in Southern Health about the divide and the conflict in the community related to vaccination and public health responses. How confident are you that physicians who are even saying that they're feeling, you know, that the trust that they have in the community is waning, how confident are you that they will be able to make these breakthrough discussions with their clients?
Yeah, I mean, first of all, it's not just a Southern health issue. I know that that gets the majority of attention, and I know there are specific concerns in Southern health, but in every region of the province, there are pockets where there is resistance. When it comes specifically to Southern health, and I mentioned this yesterday, I am concerned about not just the difference of opinions, but how that plays out in terms of people's behavior. We can have differences of opinion. We have to do it respectfully. Police officers, public health officials, doctors, pharmacists should never feel that their own safety is in jeopardy because they're giving their best advice or they're doing their job. And I think that by and large, the vast majority of Manitobans, even if they have differences of opinions, do react respectfully. For those who are not, I would ask them to, you know, reconsider not only their own views, but their behavior, because the pandemic won't last forever, but the memory of our behavior might. And we have to do better, and we have to be better as Manitobans. I do believe that the ability for doctors and pharmacists to proactively engage with Manitobans will make a difference. Now, there are going to be people who are not going to get vaccinated. Not everybody is going to get vaccinated, but we need to ensure that we're getting as many who are able, who are willing, who might have hesitancy for a lot of different reasons, but that can be overcome through those trusted relationships, that they hear that information from those that they most trust. This isn't a negative comment towards my own profession, but at some point, people stop listening to politicians as well. And they need to be able to hear from those who they've had a longer-term relationship with, more specifically and more connected and more personal. So I do think it's going to move the dial. I think it will get more people vaccinated, and ultimately that is our goal, to keep our hospitals from being overwhelmed, our businesses open, our schools open, and our houses of worship open. With Alberta in particular, I continue to have discussions with Premier Kenney. Spoke with him on the weekend again to say that where we can offer support, we're there to offer support. Provinces helped us in the third wave, Saskatchewan, Alberta, and specifically Ontario. Now that support can look in a lot of different ways, right? It depends on the kind of support that we can provide. We're a relatively small province compared to Alberta. So, I mean, there might be other things like pharmaceuticals, which we sent last week to help those who are in the ICU in Alberta. As I said to Premier Kenney this weekend, where we can help, we absolutely want to help. That's what we do in a federation. Others did it for us. We do it when it comes to forest fires, floods, and everything else. Why would a pandemic be any different? So I'll continue to speak to him and other premiers who are looking for support, and where Manitoba can help, we will help, because others have helped us when we needed help.
Nothing additional at this time.
At this moment, no.